Thank you, sir. Good afternoon, everyone. So to continue with the imaging in PCI, so my previous speaker has already shown very beautiful images of IVUS and how we can predict calcium. But now I have been asked to talk about OCT update. And I can tell you that what I'm going to show you is not only update, it is breakthrough technology in OCT, which is going to happen. I was in Europe ECR recently, where I happened to see this presentation, and all the slides courtesy are from Europe ECR. So the learning objectives would be to look at the limitations of present day OCT or other imaging. And I will be presenting to you the third generation high frequency OCT. So this is a saying, human heart is full of mysteries, but solving some of them can mean the difference between life and death. So what are the current day limitations of OCT? One is speed. One is the length of the scan. It is limited. If you have a long LAD, then we have to take 2 runs instead of 1. Then we are worried about the volume of contrast which we give in patients who have nephropathy or renal dysfunction, and the time consumed. So let us see what can be done about all these problems. So this is an angiogram of a diffuse long segment LAD disease. And what would we do in this case? Should we pre-dilate or should we go directly with the imaging? So we can see there is a very tight lesion in the mid segment before the large septal, where it doesn't look like any imaging catheter would pass through. So this is where high frequency OCT helps. And let us look at some of the trials of imaging in which we have already seen that the benefits of PCI, complex PCI, are much better, and the outcomes are much better if we have long and diffuse disease. So these are some of the excuses we have at present with present day imaging, why we don't incorporate imaging in most of our cases, and mostly so in complex cases. It takes more time, difficulty in crossing lesions with tight lesions or small vessels, and the additional contrast load. So the intravascular OCT is very important in pre-PCI planning and imaging, and pre-interventional imaging is more impactful on decision making. And as you can see from your right hand side of the graph, that 80% of the operators who were given imaging after an angiographic decision changed their decision 80% of the time. So catheter size limits crossing in severe stenosis with the present day OCT technology, also the IVUS. And the limited pullback length and scan range can miss key information with limited pullback speed and also as the contrast volume. So this is high frequency OCT. As you can see, even the catheter size is much smaller than the present day OCT. And with a simple hand injection of 10 ml contrast, we can scan a length as long as 100 millimeter within 1 second. So this is where the breakthrough technology comes in, where we can get clear visible images with 10 ml contrast and scan up to 100 millimeters. So I will show you some of the images which were shown in the recent Europe PCR. So this is a still image, and this is a Gentuity OCT catheter system. And in your middle of your screen, you can see the